Epilepsy is a disease of a brain which is caused by some abnormal synchronized discharge of the brain electricity, which cause the change in the function of the bodily function. It is what we were thinking by maybe something. It's a psychological thing, or it's the ill effect of some evil. This thing is not true. That is what it's important to consult a doctor for epilepsy. And epilepsy may be manifested by so many different or varied clinical presentation. It may the patient may suddenly lose his consciousness and start his abnormal movement. That is what we call in Manipuri Sari Hoga. And it may be some other type of presentation, in a sense like patient may not lose his consciousness but just flickering his face, or some flickering movement in the hands, or sometimes even he may be presented with some staring look, or just stopping his activities like that. So in a way, epilepsy can be differentiated into one is those who present with loss of consciousness, that is what we call is generalized epilepsy, and those who are partially or fully conscious patient are, but there was some change in the bodily function, they are called partial epilepsy. So we can differentiate epilepsy into generalized epilepsy and partial epilepsy. Generalized epilepsy is what we by general public what we call sari, but they are not very aware of any other form of epilepsy that we have to take care. Sometimes these patients are treated as psychiatric patient, or they are just some ill effect of the God or something like that. So we will, whenever there is suspect of epilepsy, we should approach a doctor. Some of the differential regarding the diagnosis of epilepsy, most important is we have to take history, or those doctors who is seeing the patient should be able to take a good history in the form that he should take the history directly from an eyewitness. And this is the only way to diagnose epilepsy. But other helpful in the diagnosis is we can get electroencephalogram, which is in short we call it EEG, and some neuroimaging also we can do. And that may help in the diagnosis, but most of the time 99% of the diagnosis is by history. Regarding the treatment, depends on the type of epilepsy. If it is generalized, we may start some form of medication. If it is partial epilepsy, we may have different drugs. That is depends on the another factor of starting different drug is about the AS factors, about whether the patient is childless or childbearing age group, or in the elderly. We have to select the different drugs for different age group of the patient. And this is very much important that you should not, patient once level as epilepsy, we should not leave the medication. We should be continuing the medication for at least 3 to 5 years. And when there is some form of neurological deficit, when the doctor examines, there is some neurological deficit, or during investigation with MRI, CT, if there is some structural defect, then we have to almost continue lifelong. Some of the epilepsy are difficult to treat epilepsy, that is when we call as refractory epilepsy. That is, in spite of adequate treatment for 2 drugs, still a patient may not get full control. Still, we should not lose our heart. In spite of that, there are so many options nowadays available in the form of vagal nerve stimulation, that is VNS. There we put some wire in the vagus nerve in the neck, and we have the pacemaker type of thing in the chest. So whenever the patient feel he may be having some form of attack, then he can press on the those thing in the chest wall, so he can avoid this thing. Nowadays there are options for epileptic surgery where we cannot control with the drugs. This has some form of operation are like laserectomy, when we can cut the structure which is actually that is called lesion where the epilepsy arises. But before undertaking the epileptic surgery, we should be fully investigating the patient, like in the form of functional MRI, SPEC, video EEG. All this is to see concurrence, in a sense that the epilepsy is arising from a definite area, and when we remove those definite or those lesions, whether the patient will have a sequelae of the operation, like in the form of some may, if we don't investigate, we don't do, there may result into paralysis or difficulty in speaking, like aphasia and all. So and we should be talking to the patient about sequelae of the operation if we are getting done the epilepsy. But it has shown very good result in very good centers. They are doing very frequently those patients with refractory epilepsy. And about do or do not in the epilepsy, like there is nothing that epileptic patient cannot do, except they should be avoiding at least 6 months for driving before it is fully controlled, and they should not be swimming without help, like he should not be swimming alone, and he should not go to dangerous machinery things around. He should not climb height, and this thing we can avoid. And sometimes we prefer the patient should have a good night's sleep, should not play video games, like that flickering lights may precipitate the epilepsy. Otherwise, patient with epilepsy can do anything, go for any sort of trade, or they can go for regular employee, and they should be able to live a normal life. Only thing is that they have to take the medicine. I find there are so many other diseases, chronic disease, where people has to take medicine, like diabetes, hypertension. People are living normally. Those very high blood sugar also they are going. They are not isolated from the society. And I want our epilepsy patient also should be like, they should take the medicine regularly, and they should be able to live a normal life. There is no way that they should get depressed because of epilepsy, because it's almost treatable or at the most controllable disease, and there is no epilepsy can cause a serious sequelae like other disease do, like diabetes. They can live 100 years of life, and that is what my message, last message is, always don't lose heart if you are suffering from epilepsy, and let us try to be in the very much in the society, and always consult a doctor, and don't forget your medicine. That's a thing. Thank you.